Hello, and welcome to my discussion on social pragmatic communication disorder. The history of social pragmatic communication disorder and what it is not. Throughout the 1900s, within the language and research of specific language impairments, a subset of people with specific behaviors, abilities, and challenges started to emerge throughout the literature. These individuals were having greater issues with specifically pragmatics. That's going to be linguistic cues, conversational norms, and social uses. In 1943, autism was first diagnosed by Leo Kanner, and in the 1900s, the it throughout the 1900s it became clear that within the language of specific learning impairment and with the addition of autism spectrum disorder starting to be recognized, there were still subsets of the population that had specific proclivities. One of these proclivities was not having repetitious or repetitive behaviors like autism spectrum disorder can have. So in 1994, when the DSM-4 was published, it had a number of different disorders under pervasive developmental disorder. This would include autism spectrum disorder, Asperger's, pervasive development disorder not otherwise specified, among others. And there was still the growing recognition that specific conditions required individual descriptions and not just to be lumped under the PDD NOS title. So that in 2013 for the DSM-5, uh, finally there were specific entries for autism spectrum disorder, social communication disorder of the pragmatic kind, as well as other specific conditions. So the DSM-5 lists some characteristics of social pragmatic communication disorder. Some of them are persistent difficulty with social use of verbal and nonverbal communications, contextual clues in social communications, linguistic inferences like jokes and metaphors, etc., and matching communication with context. For example, talking too loud in class and speaking differently to children and adults. Other difficulties not attributed to autism spectrum disorder or other linguistic impairments, and S, SPCD is characterized with also low motivation for rule following. This implies that generally the intelligence for the rule is there, but there is some disconnect between knowing the rule and being motivated to follow it. So, given everything from the previous slide with low motivation for rule following and difficulty in understanding verbal and nonverbal cues, this can obviously lead to deficits in social participation. If you are not understanding how people are using language, you are less likely to engage in it as well, at least in a positively functional way. The same thing with social relationships. If you're going to have to communicate, especially about feelings and ideas, this can be difficult. This is also going to translate to academic achievement. Again, issues with rule following, but knowing the rules. And then there's, of course, going to be issues with verbalizing needs, be it an academic deficit that they don't know for the day, or again with rule following for, say, writing nice and having to do the assignment 4 times because you don't want to write the assignment nicely. And of course, all of that can eventually lead to occupational difficulties later in life if you cannot communicate in written form and have a difficulty doing it in verbal form. So then, of course, one might ask, what are the causes? As of yet, there's not a ton of research on the causes of SPCD. There has, in fact, been minimal research on genetic or hereditary factors. Some genetic studies are beginning in the last few years. There is, however, a growing correlation in the data between students or clients who have social pragmatic communication disorder and families with specific language impairment or autism spectrum disorder histories. So there is that correlation growing. So, what are some of the therapeutics or interventions that can help students and clients with social pragmatic communication disorder? I'm going to start at the bottom of this list. Video modeling and other visual arts. This would be reminders on students' desks, alarms set and named to help students with reminders and then motivation to do said, say, hygiene or other social activity. Role playing, so they get used to knowing how to say uh, proper greetings or have proper manners or even advocate for themselves given their wants and needs. Um, Social skills groups, like you would do in many schools. This is going to be communicating thoughts and feelings. Again, practicing with manners and hygiene and greetings. And then all of these are going to be reinforced if the number one thing, parental education, is brought into the fold to help students throughout the day, both in the morning at school and in the evening with the parents and on the weekends, with constant practice of effective standard communication skills